So in this video we'll be talking about the structure of hospital organization, like how the hospital is going, everything. So everything in detail we are going to talk in this hospital organization. So before that, we should know what is meant by organizational structure. It mainly refers to levels of management within a hospital. So there are so many levels of management within a hospital. Everything that comes under the organizational structure. Okay, it may be different departments, or it may be different diagnostics, or it may be different things. So the things that are happening in the hospital, those comes under the organizational structure. So when it comes to grouping of hospital department within the structure, so we have to name those structures in detail. So hospital departments are grouped in order to promote efficiency of facility. So if any patient comes to you, if he wants to diagnose something, so for diagnostic purpose there should be some machines. If there are no certain facilities, they won't come again. So if they are coming to our hospital, we are definitely supposed to produce all the facilities. So common categorical grouping comes administrative services, informational services, therapeutic services, and diagnostic services and support services. Under the administrative services, the main thing is hospital administrators. That means who are facilitating the hospital. They are CEO, Vice President, Executive Assistant, Department Heads. So everything. If you go to any hospital, first you will want to know the which department you are looking for. So again, the head of the department. For that there will be head of the department and some people, those who are working under the department, everything. So next is informational services. So directly will you go to the hospital? No, right? You have to take the OP card and you have to make billing and you have to submit the medical records of this, everything. Next is the therapeutic services. Therapeutic services are nothing but there will be so many departments in the hospital. Like if you take ophthalmology, what they will do there, it is mainly due to the produce good eyesight. And if you take cardiology, that always dependent on the heart. And if you take any psychology, psychiatrist, their mental ability, they'll check the mental ability, everything, all the departments comes under the therapeutic services. And one more thing is diagnostic services. If you are having any problem or any infection, your sample should be sent to the medical laboratory. Or else if you are having any fracture, then you will send for the scans. So emergency medicine provides emergency diagnosis and treatment. Supportive services includes, that means in hospital support is very necessary. So in order to get everything like gloves, like equipment, everything comes under the supportive services. Housekeeping, maintenance, safe, clean environment, medical equipments, building, designers, repairing, everything comes under the supportive services. So traditional organizational chart, that is, if you know this one, everything will be easy under the structural hospital organization. First is the information services. If you are going to hospital, first what you have to collect some information about the hospital and place of the hospital. And if you go to the hospital, there you will collect the OPD card and department also. That comes under the information services. And therapeutic services, if you are going for the department of ophthalmology, there what you will do, everything, refraction, everything will be done. And diagnostic services, if you have any problem, they will send for the scanning. And supportive services, this doesn't comes under this, but hospital organization. So anything like biomedical things, housekeeping, maintenance, dietary, transportation, central supply, everything comes under the supportive services. So if you want to remember, you can remember in a pyramid shape all those things. That's all about the structure of hospital organization.